County is now in session. The Honorable Judge Marcia Lake is presiding. Good morning.
Marcia Lake has been a state court judge in Cobb County for a dozen years.
Most days I'm in court, it's a heavy court day. I see over 100 individuals that come into court. Have you gotten any return notices from this defendant?
So when,
Out of the blue.
she had pain in her lower right hip, this lifelong athlete saw a doctor who diagnosed her with muscle spasms.
I went from walking, having a very active life, to not walking.
Lake was sent to physical therapy and says she got worse. That's because it wasn't a muscle spasm.
A disc in L4, L5 had ruptured.
A herniated disc happens when one of the soft cushion-like discs between the bones of your spine gets damaged. Discs are sometimes compared to jelly donuts with a soft gel-like center. If the outer layer cracks or weakens, which can happen with injury or just aging, the gel inside can push out. It herniates. This bulging disc can press on nearby nerves, causing pain and weakness.
I'm 77 years old. It's just something that developed. I will say that it just grew more uncomfortable to walk. The big fish, which we call big boys.
Retiree Larry Garland and his wife Connie loved to travel.
Big boy.
But thoughts of trips faded as his ability to walk any distance proved impossible because of compressed nerves in his lower back.
My back would feel like I was carrying a brick or something on the back of it. It was just uncomfortable. Well, it just continued to get worse and worse until I had to use this cane to hobble around and/or a walker in the house. Connie, you want to give me that cane? It's just debilitating. When you lose your mobility, you really just lose a big part of your life. I just sat down and says, I got to get something done. I got to have some relief, you know.
What Judge Lake and Larry Garland had in common was that their back issues dramatically impacted their quality of life. They have a lot of company. Roughly 16 million people in the U.S. experience back pain they say gets in the way of daily life. According to the World Health Organization, back pain is the leading cause of disability worldwide.
I schedule my calendar a year in advance.
Judge Lake never missed work, but she was often in a wheelchair outside of court.
No one really understands when you can't walk because of the pain.
So it's going to involve one small incision in the center of your back.
I'll be out at that point in time, so I won't care, right?
So let's go.
Both were candidates for minimally invasive endoscopic spine surgery.
So the most common candidates, I will tell you, are patients that have a disc herniation, people that have leg pain, for instance, people that have pain down the buttocks, the thighs, so typical like sciatica, for instance. That's in the low spine. In the mid-back, if you have a disc herniation in your mid-back, sometimes you're a candidate for that. If you have a pinched nerve in your neck, sometimes you're a candidate for it. So you can actually do endoscopic spine surgery in the neck, mid-back, or low back.
Yep, so this is the endoscope. This here is technology that's evolved over the last 50 years.
An endoscope is a scope that goes inside your body. In the case of spine surgery, advances in technology have equipped it to do ultra-minimally invasive endoscopic spine surgery.
It has a 4K camera, and so at the very tip of it, you have the camera, you have the irrigation, and then there's a working port. And then there's also the light source. So you have all of those tools in this very thin, slim device. Through this, we can actually place instruments.
And we put that camera in, and that camera has one port that is flushing water, so we're actually operating underneath water.
Your angle makes it either safer.
Emory neurosurgeons Dan Rafai and Matthew Gary
So there's the traversing nerve root.
traveled to Germany to learn this new approach and to master its technical nuance.
Here comes spinous process.
It's popular in Europe and Asia and is gaining traction in the U.S., but is not yet widely available.
We talked to a lot of surgeons. We watched a bunch of videos, right? And then we operated on little models, like plastic models, right? And we did all this stuff to get to a point where we were like, okay, I feel comfortable enough that I'm going to do this on a patient, right? That's how medicine works.
Here's where the stenosis is at L4-5. Pretty severe pressure on the nerves here.
In order to understand just how different ultra-minimally invasive endoscopic surgery is,
We're making a really small incision. About
Dr.
1
Gary
centimeter.
describes how he would have done Larry Garland's surgery 3 years ago.
What I would have done is something we call an open laminectomy, where I make an incision in the lower back. It's usually about, I'd say, 2 inches. Basically separate the muscle off of the spine, and then we'll start removing what the whole goal of the surgery is the ligamentum flavum. So we've removed a lot of structures that you don't necessarily need to remove to get the pressure off, but you have to for a bigger open surgery.
All right, I'm gonna take good care of you.
Instead, on Garland's surgery day, the incision is closer to the size of an eraser on a number 2 pencil.
And essentially, it's through a 7mm incision, kind of like that. We dilate through the muscles, so there's very little injury to the muscles on the way down. We're targeting and attacking the area that's causing the pressure on the nerves.
Ultra-minimally invasive endoscopic surgery minimizes disruption and trauma to muscles and ligaments and tissue around the spine, which is inevitable with open spine surgery. There is less post-operative pain, less need for narcotics, and a speedier recovery. This is what this surgery can look like. Larry Garland walking unassisted to his car at lunchtime on the day of surgery. There is no hospital stay, no months of recovery.
You having any pain today?
No.
All right.
And 6 weeks later,
And a lot of this is lifestyle changes too.
at his follow-up visit, there is this.
If you had to put a percentage on it, kind of comparing where you were before to where you are today.
95.
95, okay, fantastic.
Hi, Judge Lake. How are you doing?
Judge Lake is back for a follow-up visit with Dr. Rafai.
I'm ecstatic for you. And that nerve was pinched, and that's what caused you all that leg pain?
Judge Lake is back to exercising and doesn't miss a day of court. As far as her recovery, she had open back surgery for another issue years ago and said it took 6 months to recover. This time,
I was home in my bed at 12:30 p.m. that day. I don't have any lingering pain. It's like it never happened.
Doctors Rafai and Gary trained neurosurgeon Juan Marco Gutierrez in this approach when he was a resident and fellow at Emory.
There's nothing better, there's nothing less disruptive, and there's nothing that could provide better, relief of the symptoms in a very targeted way for the patient. It was mind-blowing to see somebody, have their spine operated on and go home the same day with minimal pain medication and calling them 3 days after and knowing that their symptoms have significantly improved and their quality of life has, improved immensely since they have the surgery.
You're starting to see some yellow ligament there, you see that?
While more surgeons and residents across the country are being trained, learning ultra-minimally invasive endoscopic spine surgery presents a steep learning curve. Rafai and Gary are honest about the challenge in learning it.
Well, when you start learning a new technique, those old apprehensive feelings come back again.
This is like a super small incision through a camera. You're 12 centimeters away. You're looking on a TV screen. You're not looking at the wound.
If you've been out for 20 years and in practice for 20, 30 years, it takes a lot to go back and learn a whole new technique.
The next phase of minimally invasive endoscopic surgery, more complex spinal surgeries.
How do we take endoscopic spine surgery from what we're doing, which is primarily bone removal, disc removal, and how do we then incorporate it into the mainstay of surgery? So that's the next major phase I think that's going to happen, probably not even in 10 years, probably in the next 3 to 5 years.